Welcome to our training. I'm Stacy Farrell. I am one of the trainers and implementation leads here at Telligen, and we're going to go through our authorized official Qualitrac training. Go back. So, as I said, welcome. I'm excited to introduce you to the training session for Colorado's Nurse Assessor Program. I am Stacy Farrell, as I said, serving as the clinical implementation lead for this project, and I'll be guiding you through this important training today. We are thrilled to have partnered with the state of Colorado to create a streamlined, user-friendly process for member acuity assessments. As we launch this new program, today we are focusing on training designated individuals who will serve as the main points of contact within their organization. Once we complete today's session, you will have comprehensive training materials to support your role as an authorized official, or I'll refer to it as AO as we're going, plus a tip sheet for setting up multi-factor authentication. To keep our session organized, we're just asked that you put any questions you have in the chat, and we'll address them towards the end. But this session should help you feel comfortable as you learn about your new responsibilities and the application's features. Before we get started, we are in a unique situation with Colorado where we have multiple contracts within the state that also use Qualitrac. So if you are an existing user, you do not need to attend this training. If you are an existing user and you are looking to become the authorized official at your organization, please stay on. If you do not have access to Qualitrac at all and you are going to be the point person to create all the accounts within your organization, this class is for you. You're all welcome to stay and listen in, but I just wanted to be, respectful of your time. And if you already have access, then you do not need to attend this class. All right, so our agenda today, we're going to go over our learning objectives, our training topics. We'll go through the training. We'll have a question and answer session, and then we'll have a slide up for you to have so you know what resources you have for assistance in this role and in setting up your account. So by the end of this session, you should be able to understand the registration for Qualitrac provider portal user, understand multi-factor authentication.
Just mute.
Hello? Somebody have a question? Okay. You'll be able to access Qualitrac and navigate the Manage Users screens. So we'll do an introduction to Telligen. We'll also do an introduction to Qualitrac. We'll do a section on authorized official registration, and then we'll go through accessing Qualitrac. We'll go through the screens in which you will utilize as the authorized official to manage, add and edit users, reset passwords, and deactivate users. And then we'll provide you with some resources for assistance and contact. So now we will jump into our introduction to Telligen. So Telligen provides sophisticated analytics, population health management services, and IT solutions to more than 36 million covered lives in the Medicare, Medicaid, and commercial markets. We are 50 years providing expertise and solutions that produce measurable, meaningful results. We have more than 600 clinical and technical professionals supporting clients nationwide, and we are a 100% employee-owned company. Our employee owners drive our business, our solutions, and share our success. It's a little bit about us. And now a little bit about Qualitrac. Qualitrac is a web-based health management system built and maintained by our team of clinical and technical experts. So we have 24/7 provider access. We have a streamlined referral process with all the necessary information contained on one page. We have secure electronic upload of clinical documentation and information. And we have provider ability to we provide providers the ability to track. And when I say providers, so I'll just back up for a second. Providers to us is anybody external wanting to access the system. So it can be a physician, it can be a scheduler at an organization, it can be a home health agency, it can be case management agencies. All of those are considered providers within our system. So you'll hear me say providers, and it does not necessarily mean just physician providers. So we also give you the ability to track progress of your submitted requests.
Katie, you have a question?
Thanks, Judith. Yes, everybody, this is Katie Dobler. I'm the Clinical Operations Division Director here at the Department of Healthcare Policy and Finance. So we are the ones in charge of doing operational oversight with Telligen and implementing this new skilled nurse assessor contract. And I saw Stephanie already put a question in the chat. So you guys should have received some type of communication yesterday, either via email or an operational memo was sent out to all of the Health First Colorado providers. Just stating that we listened to you guys, that you wanted a little bit more time to help operationalize the nurse assessor. And so we are delaying the start of the nurse assessor until August 1st. So Stacy, we're delaying it 30 days. So check with all of your direct reports and your supervisors, because all of those operational memos and then email blasts went out to whoever is registered within our system to be the person who does receive all of that important communication. And then it went up on the website yesterday too. But just so that everybody's clear, this slide that Stacy's showing you right now is the correct one. So instead of July 1st being able to submit the referrals like we had talked about for the last few months, it's going to end up being August 1st. Okay?
Thank you, Katie.
No problem.
All right, so this is the correct slide. Sorry, I had two training decks open and this is the updated one. So as it stated beginning 8/1, we'll be allowing everyone to submit referrals for this program. All right, let me just get back on here. So let's go into understanding what an authorized official and what registration is required for the position. So the registration process is completed completely online. And you will get a copy of this because I believe it's either attached to the invite or Valerie's going to put it in the chat. So you can click on the registration or you can cut and paste that URL and it will allow you to register for the Qualitrac application as the authorized official. In the future, hopefully very soon, we will have a link added to the Colorado Nurse Assessor and Skilled Care Acuity Assessment webpage for you to click a button and go. But at this time, this is how we'll do it. So the process. So this registration process is completed in 3 easy steps, but there are key people within these steps that will be involved in registering your authorized official. So first we have our provider executive, and this is the duly authorized representative permitted to bind your organization. So this is your CEO, your president, owner of a practice. They will have to agree to the terms and conditions of the provider portal agreement. So they will legally bind your org to Telligen. Second, that provider executive should be having conversations and designating someone or more than one. Usually it's based upon the size of your organization. If you're a large, hospital, we usually give you like 5 people. If you're a small practice, 1 or 2 is good. So that authorized official will be the individuals who manage provider accounts within your organization. So your job will be on day 1 to set up the users within your org. It will also be to, as you hire people, do their access. and then as well as deactivating anybody who is left or assisting anybody to reset their password. So we're going to go through today just the stuff that's required for the authorized official. There will be additional trainings that come in July for using the system and logging in and your user setup and stuff like that. So this is just the authorized official role, creating accounts for those that are within your org. And then the last step will be that you as the authorized official will complete the authorized official agreement and registration form. And then this gets automatically routed to our staff who create your authorized official accounts. So again, all forms are completed online. We use DocuSign technology, and the documents are routed via email to the appropriate parties for signature. So once everybody has signed, because it will go both to the provider executive and the authorized official, and we receive an executed agreement, we get the executed agreement, and then you will receive one for your records. The Qualitrac registration team will then complete the registration process and provide instructions to the authorized official. The request will be processed and sent to you, your login information for go live. So it's going to kind of be a two-phase step, and we'll talk about that in a minute. The authorized official from your org will then need to create and manage provider accounts within your organization. If you have multiple organizations, you'll be able to set that up for both orgs. It's all in what you request. You can request more than one org if your group covers multiple entities under the umbrella of your org. So our provider portal registration account. So once you register and we receive all of the information, you will receive 2 emails. So the first email will be from qtregistration@telligen.com, and this will be set up when the account, this will be sent to when the account is set up. So you will get a link with your username. It'll tell you when when you'll have access to the portal for the assessment program, and then there'll be a secondary one. So the secondary email will come the day we activate you, which will be 8/1. So the morning, the wee hours of the morning of 8/1, our system will automatically send you your information for your account. So you'll already know what your username is. You'll get a little bit of information from our QT Reg people, our staff here. And then when it is the date you can log in on 8/1, you will get an email that morning. So as stated below, the emails for the account activation will not be sent until 8/1, and the referral process will also be available upon 8/1. And once the authorized official is logged into the system, they can set up accounts for individuals in the organization that need access to use the portal. So it's a high level of what you have to do. The instruction sheet, we also have a tip sheet too, that for filling out the DocuSign form. So I can send that also. I'll have Valerie attach it, or I can send it out to everyone that's registered. That'll just give you step-by-step instructions on how to complete the form. It's pretty straightforward. And we have to make sure that we have all the appropriate people who have their signatures. So now let's talk about accessing Qualitrac. So our link for your access to Qualitrac, which some people have access to, just not the assessment part at this point, is myqualitrac.com. You'll enter your username and password, and you'll click the sign in button. And then upon sign in, once you're an established member, or user, sorry, the system will require you to perform a multi-factor authentication, which I'm sure you're doing in any other applications that you use. So in order to have a Qualitrac account, the user must have a verification method for multi-factor authentication. So currently, Qualitrac has multiple methods for this authentication. We can do email, which tends to be the default. We have the ability to set up an authenticator app as well as phone by text or voice. We will walk through the email authentication because that is the default, but you will also receive a tip sheet that will show you how you can set up the other methods as a new user. So when you log in as a newly registered Qualitrac user, you will get an email to activate your account. It will look like this. You're going to click that activate account button. Notice that the link expires in 7 days. So something we try to communicate to all the users, as well as you will probably need to communicate that to your users in your org. If they do not continue and activate the account within 7 days, we will have to resend the activation, which you would have to go back. They would have to come back to you as the authorized official. So you'll click the activate account button, and then the users will be directed to a Qualitrac sign-in screen that will set up your security methods. So this is what you'll see. After entering your username and password, you'll be presented with a screen to set up additional security methods. So clicking on the continue button will use the email method for authentication. And then you could do a Google Authenticator or phone, and there will be a tip sheet for you to set up those other methods. Today we'll just go through setting you up with the email. So when the continue button is selected for the email, the system will display a screen to send a verification email to you. So you're going to go ahead and click the send me an email. And then the screen will inform you that the email has been sent. And that's this one. Once you go to your email, this is the email in which you'll see. I just want to remind you guys, in the next screen, I'll show you how you could resend the email as an option, but make sure that you're checking your junk mail, or make sure that you don't have email rules set up to put certain stuff in a folder so that you can use this process. But you can also send yourself another email, but if it goes to some place you're not looking, it will continue to loop. And then alternatively, let me jump into the email, sorry. You will get this email that it gives you the ability to sign in, and it gives you a code. So the sign in, when used from your email, will directly take you into the Qualitrac system. Pretty simple and straightforward. You also can copy the 6-digit code and navigate back to the login screen and put the code in. The easiest way to do it is just press the sign in button within your email. If you don't receive the email, you'll have the ability to send an email again, but again, reinforced, make sure you check all the other inboxes that you might have, or to see if the email went there. Now remember, when we set up your AO account, we will use and put the email in which you have entered in the form into your login setup. So that is the email which you'll be looking for. If you by chance, some of our organizations choose an email that everybody sees, like just an inbox that everybody will see, you would have to navigate to that one. So just be mindful as you're filling out the forms what email address you're putting in there, because that will be where the email for your authentication gets sent. All right. So let's jump in and talk a little bit about the Qualitrac admin tools, the add and edit users. It's a pretty straightforward process. I'll show you the screenshots. You'll get a copy of this to be able to utilize, but it's pretty easy. So what you receive as the authorized official, so that you know you're not just exclusively an authorized official. When you register, we give you two roles, which is authorized official and our provider portal user, which allows you to use the portal. But you, as an authorized official, will have this extra subset of rights to activate and manage other people's accounts. So you can add, edit, or deactivate users and in Qualitrac by navigating to the Manage Users screen in the Admin tool. And that admin tool you'll see here is like a little gear. And you just click that little caret or that down arrow and you'll get this option to manage users. So once you locate that, which will be in your navigation bar up top, click on Manage Users and it will take you in to our Manage User screen. This will display all users in the system connected with the organization/physicians that are associated to your access. So if you have access to multiple MPIs, you will see the people who are under those MPIs. If you have access to one MPI, you will only see the users that are in your MPI. So from this screen, you'll have the ability to add a new user, put our little green arrow to show you that's our add new user button, and we'll see a couple things on the next page. You'll be able to search for a user because you will need that to deactivate or send somebody their password, and then view their account details, which we will also look at in just a minute. So to search for a user, you can put in last name, first name. If you knew their username, you can put it in there. You can even search by email address. This will let you know if somebody already has an account within the system, or it allows you to look for their account to edit their access or deactivate them or send them a password reset. So it's a simple search. You could search by first name if there's only one Stacy in your organization and that name would come up. You can add as much information as you like. It just narrows down the universe of what data is returned. So once you pick a user or you set up a new user, this is the screen that you will come to. This one is one that's already built. So you will see the client that they're assigned to, and with your I believe there are some users in Colorado that use the UM side that may have access to other states because they're on the border and it's another state than which we manage UM for. So most likely you will just see your state. You'll have the user's first name, middle name, last name, their display name, which all of the fields here that you see that are white are have the ability to be modified by the user. So when they go to my profile, which we'll learn a little bit more about once we start getting into the training, which you'll have before you're setting up users, they can put their credentials, whatever, that's just going to be their stamp. Now, the username is a unique username for our system, and that is not editable. As you can see, it's grayed out. When you're setting up users, if you have 6 Jennifer Smiths, you would have to modify each one's. It could be J Smith 1, J Smith 2. It could be J Smith, J E Smith. However you choose to do it, if there is a unique username that you use for your organization, that can be their username or their login for their username. So if it's an email, you can do that too. It just has to be unique and it can't be any username that's been used within our Qualitrac system anywhere. So you might run into some you have to get creative if it's not unique, if it's a more common name. So you can review and update the user account details, but it's also important to let your users know that they can update their details too. When you click the Add User button from the Manage User screen, this will display a blank user setup. So you will have to complete all of the fields that have asterisks. If you look close, looks a little light. There's red asterisks next to the name. So you're going to have to select the client. The client selection will only be available as to what you have available. So if you have 2 states, they'll have 2 states there. If you're just Colorado, Colorado will be the only selection. You'll put in the user's first name, last name, display name. You'll pick their username. If the username is already used, the system will tell you. You'll put in their email, but remember that's the email that's going to be where you authenticate. So make sure that you're keeping that in mind. You will be able to pick any MPIs associated to this user. They will only have the options that you have available. So I know, for instance, dealing with some of the CMAs, they have a longer list since we've been like combining them over the past couple years. So theirs will be longer. Yours likely will be 1. But if there are more than 1, you have the ability to at your discretion assign those users to a select MPI or all the MPIs. You will put their address in. This could be your org address. It doesn't have to be personalized. The city, state, and zip will be required. Phone number will be required. The phone type, whether that's work or home, and then the preferred contact method is phone or email. And then you will click the save button here. So there'll be information to add. And, just remember that certain ones of these fields have specific criteria, like unique username, or the email needs to be able to be referenced, or they should be getting those emails for the authentication. But all of the screens except for your username or their username that you set up can be modified by the user. And we will do some of that training when we start digging into the actual the assessment management workflow that we have for the state. The org field, now this one shows multiple, which is why it is probably not your state. So we just want to give people an idea that there's the ability to have multiple assigned to one person. If you have multiple assigned, you'll have the ability to check them to assign it to the users in your org. After you click save and you've set that person up, they will receive an email just like this. We'll go to the email in which was listed, and they will have 7 days to activate their account, and then they will take them into setting up a new password. So to reset a password, you will have the ability to do so. And you can send a password reset to any of the users that are in your org. Clicking the send password reset button will send them a message to have them reset their password. And the system will provide confirmation that that password reset email is sent. So you'll see a little green box that pops up that said it was sent. So this is the email in which that user will receive. They will have 3 days to reset their password. They also have the ability on the login screen to self-reset their passwords. Sometimes they'll get locked out and you can send them a password reset as the admin. And then when they click their reset password, it'll take them to a new reset screen for them to set their new password. So when this is the password reset screen, we give you all the requirements. You have to put in your new password and then re-enter it, as we do for most standard applications. To deactivate a user, you'll have this deactivate user button. So you'll have the ability to do so. Once you hit the deactivate user button, you'll have to confirm for sure you want to deactivate that person, and you can press yes or no. So if by chance you accidentally press this button, you still have the ability to bail here. And then it will tell you in the system that the user has been deactivated. Just a note that users should be deactivated as quick as possible to prevent any PHI or PII breaches. So as soon as you know that they are either terminated, leaving, no longer need access, this should be done immediately. And if by chance you were told somebody's no longer there, but then we'll just say it was a rumor, there is still a way to reactivate that account. It just is you as an authorized official cannot do that. So you would have to, and I'll show you some of the numbers at the end of this, reach out to our support staff, and they will create a ticket, which will go to our advanced support staff at our tier 2, and they will reactivate your account. One other thing I want to talk about, I think before we get into the session wrap up, is that just like any other system out there, if you don't use the system for a long time, you're automatically deactivated. If every 90 days you have to reset your password, the same standard rules as you would for pretty much any other application that has PHI or PII. So it's 90 days, and remind your people to continue, if they don't access it all the time, to go in there and access. Now, if they get deactivated because of lack of use, this process for the Qualitrac administrative staff, we can reactivate them. So you don't have to recreate a new profile for that user. You just need to ask for them to be reactivated. All right, so as our wrap up, you should be able to understand the provider portal registration process, and we'll also provide a tip sheet for you. Understand MFA. You'll be able to access Qualitrac and then navigate to the manage user screens using the add and edit user button, the reset passwords, or the deactivate users. All right, let's open it up to questions.
There's some in the chat, I think, Stacy, too.
Okay, I don't know how to get to those. Do you want to read them out loud? I don't know.
Let's see. If this is set to launch, this is from Steve Shurin. If this is set to launch on 8/1, are we supposed to start sending PAR with a start date of 9/1 or 8/1? And that might be
Katie.
a HICPUF answer or response. I don't know if Katie is still on to answer that question.
Yeah. So who asked that question? Was it
Steve Shurin?
Okay, I'm trying to find it.
It's past the registration links towards the bottom.
Okay, I see it. So if this is set to launch on August 1st of 2025, are we supposed to start sending PARs with a start date of 9/1 of 2025 or 8/1 of 2025? So Steve, that's a great question. We get asked that question a lot, actually. And since we're moving everything 30 days, we are going to be providing more training on how to manage those PARs that are going to be expiring right when we're launching the nurse assessor. So HICPUF will be providing some more training on that. But your point is correct. Like after August 1st, you are going to need a nurse assessor assessment recommendation. so that you can submit that with your PARs going forward. So Telligen will have more educational opportunities, like Stacy said, coming up here in July. And so we'll provide that information then. And we're adjusting everything right now since we're delaying 30 days. So there'll be information on that up on the website as well.
Okay. Did you start at the bottom, Valerie? I finally found it.
Yeah, I was scrolling back through. I didn't want to skip over anybody.
Okay.
Here's one. If you are managing 2 organizations, would you need to set up 2 accounts?
Wait, say that again?
If you are managing 2 organizations, would you need to set up 2 accounts?
No. If you manage 2 orgs, when you do your registration, you're going to list both of those MPIs there so that you have access to both. You will only have one account.
This one, and I'm just going down the list from Jessica Lunsford. Can an AO submit an assessor on behalf of RN?
Can AO? I don't know that I truly understand that question.
I think, Stacy, I think what she's getting at is, can a non-clinical person, a non-clinical person, like if their AO is not a nurse, are they going to be able to submit referrals in the Qualitrac system for the nurse assessor? And Jessica, very broadly speaking, yes. So the nurse assessor request where you're going to submit for the assessment is different than anything we've done before, where we generally require medical providers to be the person submitting the request for the assessment. Like, as an example, in a PAR portal, it's usually a medical professional or somebody who works with the home health agency or something like that. For the nurse assessor, we have more of a no wrong door approach. So members will be able to submit a request for the assessment, like a medical durable power of attorney, and then always anybody involved in the care of that patient will be able to submit requests to. And there'll be much more training coming on that in July that Telligen does. This one is just to help you guys all get access to Qualitrac and set up your AO. So I hope that answers your question.
Okay. Next one, Valerie.
Does this affect the CFC waiver clients we are coordinating PARs on? So now instead of 7-1, it is 8-1 for these clients as well?
Stacy, I'll take this one too. I knew this was going to happen when we announced the delay the day before this training. So that question was asked by Lauren Smith, it looks like. So Lauren, there is more information to come on that. I don't have operational oversight over CFC, but if you want to check out their website, there will definitely be some next steps for you guys to look at.
Okay. Please review how to obtain the initial Qualitrac credentials for the AO.
How to obtain the initial credentials?
Yes, I believe that is, if they've been designated as an AO, how do they obtain the initial credentials for the AO?
Through the registration link. In order to, you have to register with the pertinent information, and I'll get Valerie that tip sheet too, through our registration link, which will credential you for the system and then allow you to set up other users in your organization. Did that answer the question? I see more messages
Yes,
popping.
thank you.
Okay,
Greta put the link in the chat. That's great. Appreciate it.
perfect.
Yeah, I see that here.
Okay.
Can the provider executive also be an AO?
Yes. As long as it's the person who can legally bind your org to the rules. They can be a provider portal user and an AO. We don't see that a lot, but we can do it. I saw a question up here about it had from Jessica. It had previously mentioned that we can submit referrals by phone in addition to the portal. Is this the case? And if so, when will that number be shared? Those calls will go through our support desk, which you'll get the number for, but we won't be accepting any calls like that until 8/1.
And Stacy, this is Judith. I would like to add that we want to encourage everyone to use the portal for a more efficient way to track these referrals. So if you have access to the portal, that would be the easiest way to submit a referral.
Yeah, and I'll add to that too, as we start doing the other training and education in July about completing the referral form. It's a really easy process. It's pretty straightforward. It's going to be a form that you just add the details that are needed and submit. All right. Let's see.
I think, and Greta is being very helpful to answer a lot of these questions too, right through the chat. So
Oh, okay.
I'm just trying to go through see which ones that she hasn't answered, and I think unless someone else raises their hands, I think we've gone through all of these. And Stacy, I was unable to attach the presentation to the chat. I don't have that option. So we'll have to send it afterwards, as well as I think Greta said we'll be posting it on the Colorado website, the Nurse Assessor web page.
Perfect. We could do that. Also, I just want to let you guys know that we will also send out a SurveyMonkey quick 5 questions. Nothing, just basic, just to see how we did for you guys. So we will have access to all the emails for everybody who's registered. So we can post that. We can also email out the documents if needed. All right. So let's go to our last page, which is our contact information. So on the email for the SNA call center and the provider help desk is listed there. We also have a toll-free phone number. And then any portal registration questions can start at our call center. And if needed, we also have our registration experts who can reach out to you.